Welcome back to Table Talk. Today we're going to talk a little bit about disc injuries. We're going to talk a little bit about the options that you have for disc injuries as well. Some non-surgical ones, and obviously there are surgical ones as well. Now, disc injuries are actually pretty common, more so than you think. A lot of people do have disc hernias, and they can be asymptomatic for many, many years. That usually affects the lower part right here across the L4 and L5 and the sacrum as well. The disc injuries, I have a little model right up here on the board. That little model right there shows that red part where the disc might bulge into that hole. And if it bulges into that hole, that's where the nerve exits the spine. And so if it exits the spine, it could put pressure on there if it's in in that foramen, that little hole. But disc injuries can also hit the middle of the spinal cord as well. So that can hit right on in here. So you have your spinal cord that goes there, and sometimes that disc can bulge into that as well. So depending on where the disc injury is or where the disc bulge is will depend on how it affects that nerve as well. Now, as far as non-surgical methods of trying to help disc injuries, obviously weight is a big one. If you put a lot of weight and it's in the front, right here in the front, you're going to have pressure that's going to be pulling forward, and that's going to put even more pressure right in those little holes. And that can cause a lot of pain. So diet, exercise are probably my big go-tos as far as helping you feel better. I would say intermittent fasting is a good way of kind of bringing down the weight so that you don't have to, run tons of miles, or, you might not be able to. If you're having disc injuries, a lot of times, you're not able to walk more than a mile a day. You're not able to walk more than 30 minutes at a time. So the good news is that walking or exercise is cumulative throughout the day. So you could do 15 minutes in the morning, you could do a half hour in the morning, you could do a half hour later. It's all cumulative. So that's a good news. So get yourself moving. Definitely diet. Get better at decreasing that weight load on those joints. And so that's the one that has probably the biggest bang for the buck is diet and exercise. Now, other methods that can be help is the chiropractic. So within the realm of chiropractic, we can do adjustments and we can do spinal decompression. The adjustments are going to help reset the nerves, and that's what we do best. We're also going to get those joints lubricating a lot better. And then the spinal decompression is actually going to help pull apart the disc. It's going to pull it apart and kind of like get that pressure to suck back in a little bit. And so you're going to be creating negative pressure by pulling it. And so basically you strap in the top half, the strap in the bottom half, and that bottom half is going to kind of pull, and the top half is going to stay put. And you can put a direct amount of force on there, and that will help decompress that spine, and it will help out those nerves. So if that does help, it's going to probably help out, and you'll see some improvement in a short amount of time. If I don't see a quantitative amount of help within about maybe 6 weeks, then even I'm not happy with the results, and I'll probably even refer the patient out for the more traditional surgical approaches. But I like to try and do the most conservative method as possible, and that's going to be, non-invasive, things that are not going to cause permanent damage if it's done. You only have a 50% chance usually of having a successful back surgery. Okay, so I'm a math guy. I'll say this: if I can help out probably around 75-80% of my patients that come through my door, then already we're past that 50-50 threshold. And then out of that maybe 25% that I cannot help, if surgery is 50-50 at that point, then there may be, at that point, out of 100 people, 12.5 people that aren't going to be helped with even surgery. But that also means 12.5 are helped with surgery. So again, I like to do non-invasive first, and if that's exhausted and we can't help that out, there's always surgery later. Why jump the gun? Okay? Last but not least, there are other non-invasive ways to help maybe alleviate the pressure. It's maybe not going to take away all of the disc pressure itself, because that disc is still going to be bulged, but it might help out the compressive forces that might cause the disc to act up from time to time. And so we're looking at stuff like acupuncture and stuff like massage, both of which can help decompress and give you a little bit of relief in there as well. Again, you probably will have, or somebody will have a disc bulge. But that doesn't necessarily mean that's the source of the pain necessarily all the time. So that's something that to be considered, that those non-invasive ways may also be good adjuncts to help out with disc injuries. keep watching us. We'll keep giving more health tips. Take care, guys.